Thank you, and I yield back, Mr. Chairman.
Thank you very much, Representative. Dr. McDonald, as you stated in your remarks and according to your report, how many community care claims did VA pay out during the first 13 months of the Pitt shutdown, and how much money does that represent?
So VA paid about 40 million claims in the first 12 months, and that represented about $28.6 billion. That was from February 1st, 23 to February 1st, 24.
Okay, thank you. Dr. McDonald, you didn't estimate how much waste or fraud there was in those payments during the 13-month period, but the improper payment rate for community care is 4.9%, and 0.1% is worth $28.6 million. Is it fair to say the improper payments were probably in the hundreds of millions of dollars?
We didn't calculate an estimate for fraud, waste, and abuse or improper payments. Our estimates were focused on the revenue collection side, so I can't speak to that amount.
Okay. Ms. Duke, according to the OIG's report, you missed $665 million in billings during the 13 months they examined, and $55 million each month after that. During all 18 months that Pitt was shut down, that works out to about $940 million of missed revenue. Is that figure accurate?
The calculation is correct.
Okay. Dr. McDonald, is $940 million an accurate estimate?
It's accurate based on the methods we use to estimate it, correct?
Ms. Duke, how do you reconcile all that missed revenue with Mr. Del Benny's statement that you collected 100.7% of planned collections through February of 2024?
So what I would say is our team utilized the time when Pitt was down to go back over previous claims that had been settled out, in some cases where we did not take advantage of the full legal window to bill third parties that we had available. In some cases, we thought the claims were too old, but legally we have up to 6 years to bill, and a lot of our providers are willing to pay. So we went back over those claims to look for lost opportunity of revenue. Furthermore, we continued to buttress our efforts in our first and third party collections for VA direct care, which is the larger part of the revenue that we collect and utilize.
So again, we get back to this planned collections and not actually opportunity of revenue, in your words, my words, receipts that are actually due. Dr. McDonald, do we know what that void is, okay, what that space is, the difference between this claim that we say we've collected 100.7% of this revenue as opposed to what's actually due?
So as far as we're aware, we haven't seen any of those 400 million claims being assessed and then billed to private insurers yet. But it's our understanding that VA started running data from the program integrity tool for revenue collections for those claims as of July 2024. We haven't assessed that yet, and we haven't seen any actual data on whether claims have gone to private insurers yet for that set of claims.
So, Ms. Duke, do you believe that you will ever be able to collect all the revenue that is actually due?
I believe we will be able to collect what is due to the extent that it was delayed as a result of Pitt. I can't commit to 100% of the collection any more than in any year I can. But from a resources perspective, to the extent that we offset our resource request of appropriations based on collection activity, I can commit that we will fully recognize the collections necessary for us to even out across the 2 fiscal years of 24 and 25. We will collect, it will just be delayed.
So we're talking about $940 million, okay? And you're saying that can be attributed to the Pitt shortfall, if you will. And so you're telling me we're going to be able to collect all $940 million?
Yes, I am comfortable that we will realize.
And when do you believe that you'll be able to accomplish that by?
I don't know if it will happen in the next couple of years. It kind of depends on how quickly we're able to ingest the data and our team can turn it around. As the data comes through, we assess whether or not it is billable. I don't know whether the first chunk of data coming through represents more billable claims or non-billable claims.
So
we'll
then
continue to monitor.
what we're faced with is this shortfall that we really don't know what it is. It's obligations that are due to the VA, but you don't know when you're going to be able to collect them, and they're sitting in the coffers of the insurance. The vast majority of it is sitting again in the coffers of those insurance companies, and their stockholders are the ones benefiting from that, not our veterans, getting that revenue back into the system to help them. I will yield to Ranking Member Surplus McCormick.
Thank you, Mr. Chairman. The VA has responsibility to inform our veterans of why they have a copay. And with that responsibility, I wanted to know, what are you communicating to our veterans in an explanation and educating them on why they owe this copay?
So when we send out the notification of the statement of earning, we include a lot of background information on what it was due to and the dates of service that are associated with it. We also include links a lot of times to all of the services that are available. They can log on and find out more information, appeal for relief at that time, and we share a lot of information that is available.
You also have a responsibility to have the information spread for a reasonable amount of time. How much time are you allocating to educate and to tell the veterans on why they actually owe this money?
So when we issue the statements, we communicate very clearly and work with them to have a reasonable amount of time. In the case of delayed billing such as this, we try to reach out ahead of actually issuing the statements to communicate, and then we'll have softer touch for those who have larger requirements.
And what does that window look like? So are you giving them a month in advance notice? So you tell them the month, hey, you owe this money, it's going to be due the following month. What does that time frame look like?
I'll have to follow up, but what I would say is that we're very soft about the due dates, particularly when it comes to a longer bill. It's not like 30 days or we'll be knocking on your door.
I want to understand that VA maintains a 6-year timely filing window for private insurers. Does that same window extend for billing veterans for copays? If not, what do VA policies say about deadlines for collecting debt for our veterans?
So there is no time limit on the veterans' debt, but because we have other abilities to work with them, we will extend a payment plan as far into the future as is necessary.
And I had with the other modernization issues that we've come across, and there's been other instances where veterans might have back payments. Have you guys taken a look at to make sure that the compounding effect is not devastating certain veterans?
We certainly are looking, particularly across VHA, we look at the combined statement for the veterans and have a full understanding of their requirements. And what I would say is we have worked very closely with the veterans, the VEO office, and also with our Office of Mental Health to make sure that when we do reach out and provide these communications, we're doing it in a veteran-centric way.
So is that analysis being done before or after? And the reason why I'm asking about the timeliness of it, is it that the veteran may be home and they get all these bills saying, hey, you have a copay for these past years. There was another glitch that we had and you owe money here again. Or are they gonna just get all these bills and be told that they have all these copays? Or are you analyzing it and in some way saying, well, this veteran may have 3 different copays because of 3 different glitches, and so we're now putting them in a different space so we can work it out individually. So is it before or after?
I would say it's before, where we have the combined veteran statement, but I will follow up to make sure that we are looking specifically to ensure that we have a softer touch with those veterans who have significant requirements.
Please do, because my concern, as I keep stressing, is that I want to make sure that our veterans aren't at home feeling overwhelmed, that they're getting all these bills, and it's saying that, hey, we had a mistake, but now you owe us all this money, especially when you're on a fixed income. I would never want anyone to be in that situation.
I would say that's why we are looking into regulatory relief so that we don't even have to reach out in those situations.
Ms. Duke, the Republicans have made some assertions that the delay in the collections for community care bills have contributed to VA's nearly $15 billion shortfall. how does the VA classify those overdue collections, and how would their eventual collection affect this shortfall?
So, put plainly, there is no part of the VHA $12 billion shortfall that is the result of delayed revenue. We did dip into our planned carryover a little bit more than we expected this year to, again, cover requirements because they were delayed payments. But as I said, when we expect to collect fully next year, we did not put that effect in our request for additional resources.
Mr. McDonald, I understand, Dr. McDonald, I understand that OIG is performing some oversight on the budget shortfall within both the VHA and VBA. Can you share more about the scope of this project?
Sure, yes. We've started 2 different projects. One is looking at a review to determine the factors and conditions that resulted in VHA's request for nearly $12 billion in supplemental funding for VHA for 2025. And one is to look at the factors and conditions that resulted in VBA's request for nearly $3 billion for 2024. So those are both started and ongoing as of right now.
Thank you. I yield back.
Thank you very much, Ranking Member. Now recognize Representative Self.
Thank you, Mr. Chairman. Ms. Duke, what's the average amount of time it takes to collect every dollar, for non-connected care after the care is delivered? What's your average?
I'd have to get back to you on that.
Yeah, I'd like to know, because you just said that it doesn't represent a significant amount of the $12 billion. So you have 6 years to bill, correct?
Correct.
Do insurance companies have a statute of limitations on what they will accept?
So a couple of our insurance companies who we work with, we have contracts that predate the legislative permissiveness to bill for the 6-year period. So in those cases, we've been honoring the contract and working with them to see if we can continue to extend it. But it is not industry standard, but it is appropriate given the way in which we do our billing, because we bill as though it were care provided in our direct care system.
I think you just said that they don't accept your bills.
They accept our bills. They will push back to the extent that there is a contractual disconnect with what is.
Do they pay the
able by.
bills?
We work with them through our general counsel to seek.
What percentage of the bills do they
I'd
pay?
have to get back to you on that.
I really want to know that. That may be something we need to examine legislatively, if it's a significant amount. Dr. McDonald, so in 2022, your office found that VHA did not submit over half of the billable claims before the filing deadline, carrying a huge amount of, how many recommendations did you have on that issue?
We had 3 recommendations from that report from 2022.
Mm-hmm. How many have closed?
All 3 are still open. We paused assessing the recommendations during the PIT pause because we need the PIT to be up and running for revenue collections to be able to assess VHA's responses to the recommendations.
So when do you expect to start review?
We don't have to wait till all 40 million claims are processed. We expect to be able to start assessing them once we know that revenue operations is billing private insurers. We have to wait till that link is made and see how that's working to see if the recommendations have been implemented.
So you're not doing any review at this time on these 3 open recommendations?
Not right now.
Okay, Ms. Duke, the factors you consider when you estimate medical collections in your budget, what factors do you consider?
So we have an econometric model that looks at historical success in terms of our first and third party collections, and we look at the amount of care that we expect to deliver in the year, and based on that, we develop an estimate for what we will be able to collect against our anticipated.
Is that a subset of PIT?
The PIT is the way in which we gather the data to issue the bills, but based on what we've billed through PIT in the past is how we make the projections that we use in our budget formulation.
So you budgeted for the coming, or the fiscal year we're in, 4.4 billion, right?
Correct.
What do you expect to collect?
I would say we actually expect to collect more than that because we will work our way through the delayed collections from 2024 and utilize overtime and contract and hopefully some more staff to work more quickly through revenue than what we had originally expected.
Okay, Mr. Chairman, I yield back.
Thank you, Representative Self. Ms. Duke, I'm going to attempt to get to the bottom of the delayed medical collections and your budget shortfall. I continue to hear this information that one doesn't impact the other, but I don't see how in the world that can be. First of all, how much are the medical collections that are delayed from fiscal year 24 to 25?
How much is the delay?
What is the value
So we
of
don't,
those collections that have not been, that you're projecting that are not going to be collected from 24 to 25?
so we have provided additional resources to the field out of our carryover to offset what they perceived as lost collections, but we actually are on target to come close to our collections goal for the year.
So you initially told us $700 million in July. Would you like to revise that number?
That is the impact of the PIT delay. At the same time that the PIT was delaying first and third party collections in the community care world, we have been utilizing our ability to try to maximize and increase collections from the direct care system.
Okay, so you've been trying through the direct care system. So you initially told us that number was going to be $700 million. Would you like to revise that number?
That is the estimate of what was not collected as a result of PIT being down. I would say that is not the total difference from our expected returns and our collections activity for the year.
So would you like to revise that number?
What I would say is that on average, monthly collections within the VA are between 300 and 400 million. Not necessarily during the PIT, but the Change Healthcare did cause us to reduce monthly collections to right around 150 million, and now we are actually above that 400 million moving forward for what we expect to receive for the remainder of the fiscal year.
So again, that's all great, fine and good, but how does that impact that 700 million? Is that still your target? Do you think that is still going to be the shortfall? Do you think it's going to be more than that? Do you think it's going to be less than that?
So what I would say is, and I apologize for the confusion, collections is a time mushy kind of world where
I
we
understand,
issue the
again,
bill.
because this is where we continue to have this conversation about what is actually obligated to the VA and what you are targeting that you think reasonably you can collect. There's no really any other business in the world that functions that way. You either have receipts due and you are going to be able to collect them, or you are not going to be able to collect them. And to come into this room and say, we are collecting 100% of what our projection is, you can make that projection number whatever you choose to. That is very disingenuous and dishonest to the committee. Mr. Delbenny, you can roll your eyes and make faces, but you can make that projected number anything that you choose to. You have obligations. And so what we are trying to determine is how this is all impacting the budget. No, you can't. I'm moving on. Ms. Duke, when I asked Dr. Elnahal about this issue last week, he characterized it not as a budgetary issue, but more of a cash flow issue.
That's correct.
Well, it's correct, but there's revenue that is due, and if it's not being collected by the VA, then that has a direct impact on your budget. He also said, ultimately, the cash in the bank account is lower than we had hoped and expected because of the collection issues between Pitt and the Change Healthcare incident. Ms. Duke, basic question. Are you requesting supplemental appropriations to make up for these delayed collections?
No, we are not.
So if we have this additional revenue then, and I've got a statement here that you all just provided yesterday, and nowhere in there does it reflect that. It doesn't show the shortfall. nor does it show the revenue that you're anticipating to collect. So where is that silo? Where is that account being managed? And it's basically, from my standpoint, because it's not reflected in here, it's being utilized as some kind of a slush fund. Whatever you get, you can redirect. Whatever you don't get, you don't have to claim. And meanwhile, you've made your budget request on these forms, not reflecting all of the information about what your income and what your obligations are.
The president's budget for 2025 was transparent about the fact that we expected to have significant carryover, both in base and TEF resources, from 24 into 25 to offset our expected requirements in.
Did you have that revenue carryover?
So that is where we see the impact of the PIT tool. We expect that we will carry over less than what we had expected from 24 into 25. We did not increase our request for additional resources because we expect to make up that lost carryover via collection activity in 2025, and that is the cash flow that Dr. Elnahal was referencing.
Again, it's not reflected in those numbers. The revenue nor the obligation is not being reflected in the statement. So as far as I can tell from my standpoint, this is a mystery account that you are not accounting for. I will now yield time to Sheriff Melissa McCormick to ask questions.